And now we have Dr. Mythili Ramachandran, who's an internist at Bonney Lake Medical Center in Washington.
I'm here to talk about diabetes and prevention and treatment with a vegetarian diet. So I have 3 goals for the talk today. And the first question is, can a vegetarian or vegan diet help reduce the incidence of diabetes? The second question that I'm going to try to answer is, can a vegetarian diet help us improve glycemic control in our diabetic patients? And the third question is, can a vegetarian diet help with some of the end organ damage that we see in diabetes, such as neuropathy, where we have a really good study? So before I go into the vegetarian diet, I just have one study to share with you about the association of meat and diabetes. And this is from the Nurses' Health Study. The Nurses' Health Study is 70,000 patients who provided questionnaires. They were provided questionnaires about their diet over a period of 14 years. And they showed, this is the data from that study, they showed that every quintile increase in red meat increased the risk of diabetes by 26%. That was for red meat. For processed meat, every quintile increase in processed meat showed an increase of 38% for diabetes. And processed meat includes hot dogs, bacon, sausage, pepperoni, and I think each serving for this study was, one serving equaled either 1 hot dog or 2 strips of bacon. Now we go to the California Seventh-day Adventist study, which is the largest study that we have that shows us the difference between a vegetarian diet and a non-vegetarian diet. This was 22,000 patients in California who, again, filled out questionnaires about their diet and were followed for a period of many years. And the California Seventh-day Adventist Health Study 2 is still ongoing, and they have recruited more than 100,000 patients in this study. And this study, as you can see, the more restrictive that the diet became, there was a significant decrease in the incidence of diabetes. Even semi-vegetarians, I think we have patients all the time that say, it's really difficult for me to go to a vegetarian or a vegan diet. I practice in a small community, primarily middle-class patients, and they always tell me, I'm a steak and potatoes guy, what do you want me to do? So I always tell them, start with a couple of days a week. Just start with a couple of days a week, and then I see them a few months later, and they're ready to go forward, maybe 3 days a week, and then go forward from there. As you can see, even if you're a semi-vegetarian, although this study, semi-vegetarians were 1 day a week or less of meat intake, there was a 28% reduction. Pesco-vegetarian, almost 50% reduction, and lacto-ovo-vegetarian, 60% reduction. This is from the Adventist Health Study 2. The data is a little bit different. And here again, you see the first bar graph is the actual prevalence of diabetes. And you can see the curve going downwards for each type of restrictive diet. And the second bar graph is the odds ratio of developing diabetes after it's been adjusted for BMI, age, ethnicity, and physical activity. Once again, the odds of developing diabetes, 49% lower with a vegan diet. Furthermore, from the Adventist Health Study, when we looked at the data between the non-Black population, the Black population had a significant advantage over the non-Black population. Between those 2 groups, they saw that there was a 70% increased incidence of diabetes in the Black population versus the non-Black population. But that risk was mitigated completely if they became vegan. As you can see, the odds ratio of diabetes, non-vegetarian versus vegan, is 70% lower. That was the California Adventist Health Study. Now we move on to Neal Barnard study. Neal Barnard is in Washington, D.C. at the Physicians Committee for Responsible Medicine. And he has done a study with 99 patients, 50 of whom were assigned to an ADA diet, and 49 people to a low-fat vegan diet. And at the end of 22 weeks, they met with a dietitian and a physician every week for the first 22 weeks. And at the end of 22 weeks, what they found was a 1.2 point reduction in A1C in the low-fat vegan group. And the American Diabetes Association diet, actually they restricted the number of calories that they took in if their BMI was greater than 25, whereas they did not restrict the calories for the low-fat vegan diet. And you see a significant difference between the two groups. They did not adjust medications during this time period, but what they did is if they developed hypoglycemia, they took them off medications if their blood sugars were going low. And you can see that 43% of patients in the vegan group were able to come off their medication, so reduction in medication, and that was significant, as opposed to 26%. Remember, these patients are still having, in the ADA diet, some dietary intervention. So the same study was continued after 22 weeks up to 74 weeks, and you can see that the difference, although got a little not as good, after 22 weeks they were meeting with the dietitian every 2 weeks instead of every week, and now the difference is not as big. However, it was still sustained until the end of the study at 74 weeks. The lighter is the conventional ADA diet, and the darker is the vegan diet. So lastly, we look at the Crane study that looked at the association for peripheral neuropathy, treatment of peripheral neuropathy that Mr. Stewart was alluding to. This is very significant. Again, took 99 patients, and 50 patients, no intervention was done. 49 patients were put on a low-fat vegan diet, and at the end of 20 weeks, they found all of these were reduced, but 80% improvement in pain symptoms in a month, 65% decrease in medications, and 71% continued to be pain-free after 4 years. And this study was initially for 20 weeks, and then it was extended. The medications that we use to treat diabetic neuropathy have a lot of side effects. Diabetic neuropathy, as you saw in the previous slide, affects 47% of patients with diabetes, and this is a very simple solution to treat diabetic neuropathy. Not only did they see an improvement in the pain scores, they used the McGill pain score and the Michigan Neuropathy screening instrument. They also saw an improvement in the electrochemical skin conductance in these patients with diabetic peripheral neuropathy. So I just want to conclude my talk by saying, let food be thy medicine and medicine be thy food. This is from Hippocrates, who is the father of modern medicine. I think as physicians, we all have the responsibility to consider and educate our patients as to how food can affect their health and disease. Thank you.